Hello everyone watching this video, I'm Vicky. What is diabetes? Numerous individuals possess the ability to elucidate this ailment in their own terms as it commonly afflicts individuals in their later years. Today, I will present a diet-related condition known as diabetes. In more technical terminology, diabetes encompasses type 1 and type 2 variations, both characterized by a persistent elevation of blood glucose levels. The complications associated with this condition can result in vision impairment, limb loss, renal failure, as well as cardiovascular and cerebrovascular disorders. Adhering to medical guidance and enhancing self-management abilities are pivotal in mitigating the impact of the disease and potentially achieving improvement. Let's begin by discussing the symptoms that may occur if one develops diabetes. Initially, there won't be any noticeable discomforts. This is known as early diabetes or pre-diabetes, which typically lacks obvious symptoms and clinical signs. Diagnosis usually relies on a blood sugar test conducted at a hospital, making it difficult for individuals to realize they have diabetes without undergoing related examinations. However, once the disease progresses, cardinal indications may arise depending on the type of diabetes. For individuals with type 1 diabetes, onset tends to be relatively rapid. Prior to diagnosis and treatment, common symptoms such as excessive thirst, frequent urination, increased appetite, and weight loss might manifest. In many cases, initial manifestations can include diabetic ketoacidosis, coma, or acute abdomen. Early initiation of insulin therapy is often necessary for managing the condition effectively. Additionally, some adult patients experience a gradual onset without evident clinical signs in the early stages. Therefore, regular blood glucose testing becomes crucial for detection. In the case of type 2 diabetes during its early stage, certain patients might experience hypoglycemia after meals characterized by palpitations, nausea, and cold sweats occurring approximately 3 to 5 hours later. This form of diabetes commonly affects adults over 40 years old and often remains hidden initially, with half of the patient being asymptomatic. Many cases are discovered through chronic complications or routine health examinations due to family history, often accompanied by obesity, dyslipidemia, hypertension, and other conditions. Some diabetic patients with significantly elevated blood sugar levels may also exhibit visual changes, as well as skin infections. Other complications and accompanying symptoms include prolonged elevation of blood sugar levels in the eyes can lead to retinal vascular disease, which may cause vision loss and potential blindness. Individuals with diabetes have a significantly higher likelihood of developing eye conditions like cataracts and glaucoma. The healing process for foot wounds becomes more challenging after injuries, increasing the risk of infections and ulcers. In several cases, systemic infection and osteomyelitis may occur, potentially resulting in amputation if not appropriately treated. After we talk about those information for diabetes, you might become interested about the treatment for this disease. Medical nutrition therapy is the fundamental approach to managing diabetes, aimed at assisting patients in developing a personalized dietary plan, establishing healthy eating habits, determining an appropriate daily energy intake based on their ideal body weight, and achieving or maintaining an optimal weight. Individuals with normal weight should consume around 15 to 20 calories per kilogram of ideal body weight per day during bed rest, and 25 to 30 calories while at rest. Carbohydrates should contribute to 15 to 16% of total calorie intake, with adult patients consuming approximately 250 to 400 grams of staple food daily while limiting the consumption of simple sugars. Protein intake should account for 15 to 20% of total calories, with adult patients recommended to consume 0.8 to 1.2 grams per kilogram of ideal body weight per day. At least half of this protein should come from animal sources. Fat intake should make up about 25 to 30% of total calorie intake, with saturated fatty acid comprising less than 10%, and cholesterol less than 300 mg per d. It is advisable to include foods rich in dietary fiber in the diet. The daily energy intake should be distributed reasonably across each mealtime. One possible distribution could be dividing it into 3 equal portions, either as 1/5, 2/5, and another 2/5, or as thirds. At the end of this video, let's make a conclusion for this. Diabetes is a chronic condition characterized by high blood glucose levels and can lead to various complications. Early symptoms may be subtle or absent, making diagnosis challenging. Type 1 diabetes often presents with rapid onset and symptoms such as excessive thirst, frequent urination, increased appetite, and weight loss. Type 2 diabetes may have hypoglycemia after meals as an early symptom, and the regular monitoring and medical guidance are crucial for managing the disease effectively. Now it's the end of the video. Thanks for watching.